What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase, list it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
Why did the cat open Pandora's box? Curiosity. And also, it was made of cardboard. What do you give a basketball player who never washes their jersey? A fragrant foul. Why did the kittens get in trouble during school? They were copycats.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease. So I'm paging Dr. Steve. Dr. Steve.
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine practitioner. Gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And we also have my partner in all things, Tacie. Hello, Tacie.
Hello, everyone.
Do you have topic time for today?
Yes.
Well, thank you. This is a show for people who had never listened to a medical show on the radio and the internet, or on the radio, or in the internet. Well, is it in the internet or on the internet? I guess it's on the internet. If you have a question you're embarrassed to take to your regular medical provider, but you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Very good. All right, please don't forget stuff.drsteve.com, stuff.drsteve.com for all of your stuff needs.
There you go. That's a way to sell it, Dr. Steve.
And don't forget the Phoenix, the erectile dysfunction device that I'm doing a clinical trial with an N of 1 on myself just for fun. Check it out at ed.drsteve.com. If you go there, you can get a discount. You can get it for $29 a month. It is not cheap, but it is acoustic shockwave therapy, just like you would spend thousands and thousands of dollars for at a medical spa, and you'll have some person holding your jungle region that you don't know while it's trying to shrink into your body because you're mortified. And instead of doing that, you just do it yourself at home. So check out ed.drsteve.com. That's echodelta.drsteve.com. And check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And patreon.com/weirdmedicine. Tacie and I do a show on there. And then we do a thing called the exam room. And I'm getting ready to, one of the reasons we had technical problems this week was because I completely redid all of my OBS templates and then realized that the profile and scene collections are two different effing things. And I did it all on my profile. I did a new profile, and I completely destroyed all of our templates and everything. And we were 45 minutes late getting started today because of that. So I learned my lesson. But anyway, I've got brand new scenes for that. I'm going to be able to pull up articles on the internet and rail about them. And all I'm going to be doing is raising holy hell and getting angry about shitty medical journalism. And I'm starting with that gosh darn, almost said a very naughty word, Tacie, article about erythritol. That's going to be the first one. So it'll be on, those will actually go up on our YouTube eventually, but Patreon subscribers will get them a week ahead of time, something like that. Or I'll get a collection of them and then I'll throw them up on YouTube after a while. So those will be live streams. That'll be fun. It's coming. So check us out. Patreon.com/weirdmedicine. And if you want me to say fluid to your mama, go to cameo.com/weirdmedicine. It's cheap, fun, and all the proceeds go toward ham radio. And my buddy Dale and I we've amassed enough funds now that we're going to set up a moon. I know Tacie thinks it's hilarious. A moon bounce setup where we will be bouncing signals off the moon and talking to people wherever they can see the moon. Oh, go! You know it's.
Oh, sorry. Are we still
no
on?
kidding.
Are we still on?
It's fun. You guys are shitheads. All right. Well, very good. Don't forget to check out Dr. Scott's website at simplyherbals.net. Simplyherbals.net. And I do want to make a correction. Last time we talked about monkeypox and smallpox, and we got unfortunately I did not get this person's name, and I apologize, but they're a PhD or an MD or something. They said on that episode, some of the information you provided about smallpox and cowpox and monkeypox was slightly inaccurate. This person was being very kind. It was completely inaccurate. And so I'm just going to read his words because I talked about I'm so stupid. And so I knew when I said it that I was saying something idiotic. And the underlying idea was right, but the history of it was completely wrong. I said that Jonas Salk immunized individuals with cowpox to prevent smallpox. And I'm sorry, but...
You see, your stupid minds, stupid.
The correct individual is Edward Jenner. So we got to give Edward Jenner credit.
Yes.
In 1796, he noticed milkmaids who contracted cowpox didn't get smallpox. So you have the sort of the landed gentry, and they're all getting smallpox and dying from it. But the people that they send out to work with their cows and get milk and stuff so that they can feed their privileged children who are also getting smallpox weren't getting it. They were basically immune from it.
Wow.
And so he immunized this 9-year-old boy, and we know the kid's name. His name was Edward Phipps. And he inoculated him with lesions from the hand of a milkmaid on day 0 and on day 31. Okay? So on day 60, he tried to give this kid smallpox.
Oh, for goodness sakes.
Okay, so he challenged the boy with lesions from an individual suffering from smallpox. Now, this was ballsy AF, and wondering if poor little Edward Phipps maybe didn't have, rich parents. I don't know. I don't know.
His parents signed a waiver.
Let's look him up. Let's look up Edward Phipps and see who this kid was, whose parents had the balls to let this Edward Jenner guy give him inoculations a month apart of cowpox, and then give him smallpox. And he observed that Edward Phipps did not develop smallpox and thus was protected based on immunizations with cowpox. So this was the absolutely first intentional vaccine. And the term came from... the term vaccination came from, he says vaca meaning cow. No, I think the virus was vaccinia, which was derived from cow. I probably said that wrong too. So let's see.
Vaca is
vaccinia.
Spanish.
Yes.
Vaca.
Yes. Okay. So vaccinia virus was named from the cow. Which was a pox virus similar to smallpox but less harmful. So there you go. Okay, so so the term vaccination came from vaca, meaning cow. In contrast, Salk developed the polio vaccine. Of course, but what Salk did was really cool. Was he ran the polio vaccine, which was wild type, into what we call non-permissive cell lines. And what this did was generated the first attenuated version of poliovirus. And so he created the first live attenuated vaccine.
Okay.
And therefore, that classroom that was in my school when I was in kindergarten with all the kids in the wheelchairs, nobody remembers that anymore, because of Jonas Salk. So polio sucked, and it was a real thing. And, measles sucked, took out one of my classmates in kindergarten. And people who are, fully anti-vaccine do not remember those days because they only remember how things are now, which is we are not ravaged by those illnesses. And I had somebody the other day say to me, well, there's more people harmed from the vaccine now than there are harmed from measles. It's like, right. Yes, that's correct. That is the sign of a vaccinated society. Right? Because we don't have the disease. Well, now it's coming back here and there.
That's crazy, isn't it?
But so if you have zero disease, and you're vaccinating millions of people, of course you'll have more harm done by the vaccine. But you still have to look at that risk-benefit analysis. 1 out of 1,000 kids with measles will die. And show me the statistics on the vaccines, not anywhere even close to that. And I mean astronomically, vanishingly small to the point of being close to zero. Okay, statistically. So, it sucks. Tacie and I knew this. We had 2 kids. We both were like, oh, the vaccine. Okay, well, we're going to do it. But we were holding our breath when we gave our kids vaccines, praying that they weren't in the 1 in a jillion that had an adverse reaction. Mm-hmm. And even when you know the numbers as intimately as we do, there's still a little bit of temerity there when you go to give your kids shots. And the worst for us, knock on wood so far, for our kid is he now has needle phobia, because I remember when he was, 18 months or something, they held him down and they had 3 nurses holding him down, and 2 nurses or 3 were injecting him simultaneously at different sites on his thighs, and he freaked out, and now he's afraid of needles. Understandably so, and doesn't remember why, but it's got to be that.
Yeah.
But anyway. All right, so the person that sent me that, I'm sorry I didn't write your name down. I promised I would remember your name, and I forgot it, and that's on me. But thank you very much for correcting me on that one. And I give myself a...
Man, you are one pathetic loser.
That was for me. Now, you guys are going to be competing for bells the rest of the time, but I have -10, so it's going to be a while before I'll catch up. You guys want to do the Mom Swipes question of the week?
Sure.
Okay, let's do it. Tacie, you good with it?
Yeah.
Were you didn't hear it last week, did you?
No, I did not.
So that podcast that I was on, Mom Swipes Left, they were quite hilarious and really kind of get the show. And I said, just send in whenever you want to. Send us a question and we'll put it on the air and then plug your podcast. So here it is.
It's time for Mom Swipes Left Has Questions with Jen and Carol from the Mom Swipes Left podcast.
Dr. Steve, Carol and I have been talking. So we were comparing earwax detail.
Yeah.
As you do.
No, you don't.
Carol's earwax is, Carol?
It's like a little bit sticky, yellowy, orangey. There's not a lot of it, but...
Okay, I'm already kind of grossed out. Have you ever seen my earwax other than going, ew, you got earwax coming out of your ear? I mean, you and I have been married for how long?
Oh.
I don't think Tacie makes earwax. Matter of fact, I'm not sure Tacie moves her bowels. I have no evidence that she does. Right?
Yeah, we just don't do that kind of thing.
No. So this is, they must be really good friends, but... Scott and I are very good friends, and we've never done this, so I don't intend to start.
It's it's like it's like thick.
Matter of fact, I'm sure what comes out of Tacie's colon just smells like flowers.
I was thinking roses.
Yeah.
It probably looks like roses too.
Yeah. Probably is roses. Tacie shits out roses.
Roses.
Wait, so how do you get it out of your ear hole?
I just put some Q-tip in there.
You're not supposed to do that.
Well, that's what I do.
And it's orangey, yellowy?
Yeah.
Does it smell?
No, I don't. Well, I don't smell it.
Oh.
What's it taste like?
So,
okay.
I'll save it for you next time.
Would you?
Yeah.
Okay. So my earwax has always been sort of off-white and flaky.
Okay.
And I've never had the chunkers that these people are talking about or the chunkers that I see advertised on my Twitter feed.
Right.
Which
well,
is
those
nasty.
are probably over-exaggerated, but yeah.
Fucking gross.
What the hell is
Looks like a goddamn kidney bean.
Flaky off-white earwax.
Oh, no.
Are you asking me?
Okay, won't be able to eat kidney beans for a while.
Me?
No, I'm asking him.
Oh, yeah. So why? Why does my earwax seem so different than other people's?
Or are there different kinds of earwax?
You're the best.
Thanks,
Thank you.
Dr. Steve.
Hey, thank you. So, yes, there is a natural variation amongst humans, and we all have different earwax. I, for example, once every 3 months have to use the Murine ear kit, and we'll talk about that in a second, the best way to clear earwax out of your ear, because that's the utility of this very important question. But once every 3 months I have to do that, and mine's dark and brown and, globby. And then other people have just sort of flaky earwax, as our caller does. So whether that was Jen or Carol, I still haven't figured that out yet. So, but the ear canal is lined with these hair follicles, right? And it's got those hair follicles, and the skin in there has glands that produce oil, just like our regular skin does. But, on your skin, if you could prevent that oil from being swept out to the rest of the world, you would have globs of oil on your skin, and when it dried out, it might look something like earwax, but they're slightly different. The waxy oil that produces in the ear is called cerumen, and it almost always makes its way to the opening of the ear and then just disappears. You can sneeze. Are you sneezing?
I was going to. I'm sorry. I was trying to turn my head away.
That's okay. Yeah, no, I appreciate that you didn't just
goodness
sneeze
sakes,
right
blow all over the $1 million microphone.
But so the earwax normally will sort of migrate out to the ear and then just disappear because it's almost microscopic. But if it blocks up, then builds up, then it can block the ear canal. And when it does that, it's the most common cause of loss of hearing. When I was doing primary care, people would come in and say, I can't hear out of my left ear. First thing you do, you look in there, and there's a big glob of wax. And I'd get old Wander Gully over there, and who was my nurse. And she'd get this giant silver syringe full of warm water, and she loved to do it. And you'd hold an emesis basin under your ear and tip it toward her, and then she would run that thing in there. One swipe with that thing, because it had a really good flow of fluid through it, and she knew how to aim it just perfectly so it would go in and glance along the top of the ear canal, turn around and bounce down along the bottom part, and it would sweep that cerumen impaction with it. And she'd get these big globs of things. And that's a very grateful patient, too. You know, we talk about the grateful patients that come in with an ingrown toenail that leave pain-free, or a thrombosed external hemorrhoid and they leave pain-free. But also those that are coming in feeling like they're going deaf and come out with full auditory acuity because you cleared out cerumen impaction out of their ear, are also very grateful patients. You know, where you could do something immediate like that. All right. So yeah, that's the thing, is just you're just different. Some people have oily skin. Some people have oily hair. Some people have dry flyaway hair, you know, and everybody's different. So that's really all that is. And, you know, in some people, these glands produce way more wax than can be removed. And when that happens, then you get this buildup. And so how are you going to deal with that at home? You can go to your provider. I think we used to charge $100 for that. Well, it's just a regular office visit. Or you could do it at home. So don't use Q-tips. When you cram Q-tips in an ear that has a wax impaction in it, all you're going to do is push the wax further into the ear and make it more compact. So what I recommend, the cheapest thing to do is get a thing called a murine ear kit. And CVS and Walmart Walgreens and you know, other places like that sell generic, their house brand versions of these. But basically what's in there is a little tube of a glycerin that has some peroxide in it.
Okay.
And so you'll lay down and watch Seinfeld, get the bad ear up and put 5-6 drops in there. Just fill up your ear canal with this glycerin stuff. What that's going to do is soften it.
Gotcha.
And the peroxide will help to lift off some of the surface goo, and maybe even work its way around the side of the impaction and build up a little bit of gas pocket in there to make it easier to dislodge from the wall. And then after about 30 minutes, so an episode of Seinfeld, then you get up and run warm water in a sink and plug the sink up. And then, but it needs to be warm, lukewarm. Body temperature, and there's a little bulb syringe in there, and you turn the bad ear down toward the water, and you fill up that bulb syringe with fluid, you know, with water,
with the fluid,
with the yes, exactly, with fluid, and then you start to syringe water into the ear, and you want it to be forceful enough that it'll dislodge it, but not so crazy forceful that you're going to hurt yourself. So if you cause pain, you're doing it wrong. And you want to kind of angle it. You put the tip in just inside, just barely inside the ear hole, and then angle it sort of toward one of the walls. So you don't want to shoot it straight in. That doesn't do anything. That just pushes it in. You want to angle it in so, again, it glances against one of the walls of the ear canal and then curls back around and sweeps that wax out with
a bank shot.
Yes,
it's a
very
bank
good.
Shot,
Okay,
yes.
yeah. I'll give you a...
Give thyself a bell.
Well, I guess I'll have to start paying attention now. Shit.
Game on. Game on.
So, yeah, Tacie.
You get nothing.
Yes.
So do the bank shot with the fluid, and then you'll start to see, if you're lucky, you see a nice big bolus of wax come out, and now all of a sudden your hearing is back to normal again. So I'll do that if I have to go get a physical, because every time I go in, they look in my ears. They got to get the little curettes out and start cleaning my ear out, and it's embarrassing. It's gross. Mm-hmm. It's just like if you pull down your pants to do a rectal exam and there's just shit all over your ass.
Well, it's not quite the same.
Well, to me it is.
That's a little different.
To me, it's very similar. I mean, you're gross. It's just being gross.
That is true. The gross factor is.
Yeah, or if they do a prostate exam and fluid comes out the end and they weren't expecting it.
Oh, yeah,
it's not good.
Not good.
That will happen, by the way, and you're not ejaculating when that happens. It is just fluid dynamics. That if you come in with prostate pain, and they bend you over and stick their finger up your rear end, you want fluid to come out, but they're supposed to give you a slide or a petri dish or something to collect it so they can look at it under the microscope. Because when you express fluid from the prostate, if you've got an infected prostate, you'll see white blood cells. Otherwise, you shouldn't see any of that.
Right.
That's just somewhat of an aside.
Yeah, a little bit.
Well, okay, but it's gross. You're looking in your ear and it's full of wax. They got to dig that out, and then you pull down your pants.
If we're going to judge
there's
gross
skid
things,
marks.
I'm pretty sure
and then they stick their finger in there, and then
one.
stuff's coming out of the end of your penis, your horrible, horrible, flaccid penis. It's horrible.
Yes. Too much fluid, Tom.
Yeah, I know. What other gross things could there possibly be? Just belching when they're examining your abdomen, or going hee 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 because you're ticklish and they're examining your abdomen. I had that happen to me once. Well, I didn't actually make that sound. I was making it in my head, but I was kind of jerking because it's like, dude, I'm ticklish.
Oh my God!
And you're 67 years old and you're ticklish.
Oh my God!
Touch the bottom of my feet either. All right.
Or his back.
Or my back, right.
Just don't touch him.
Yeah.
He's gross.
All right. Enough. Okay.
Hey, Dr. Steve. This is Brandy, the pharmacist who emailed you.
Hello.
I'm calling to let you know that I don't remember what you were talking about, but it was something regarding waiting at the pharmacy and what are they doing back there and how long does it take? And
No. It was we were talking about insurance.
Yeah.
And why the pharmacists don't just pick up the phone and call if something's not covered by insurance. But also we were talking about how pharmacists, like everyone else, are fallible, but not to shit on pharmacists, but to say if pharmacists are fallible, what about the guy making meth in the trailer out in the parking lot? And speaking of people making meth in the trailer of the parking lot, did you know, this is the craziest effing thing. I'm a notary public, right? I got notarized so that I could notarize living wills. Because we do a lot of, and we don't even call them living wills, they're medical advanced care plan.
Okay.
And so in my research, I was trying to come up with a one-page universal medical advanced care plan that would be accepted in all 50 states, because there are some rules. And in my research, what I found was that if I notarize a medical advanced care plan, and if people don't know what I'm talking about, this is just everybody listening to this needs one, where it just says, if I'm in a coma and I'm never going to wake up and I die, do I want CPR or do I not? And the answer is you do not. But it's up to you, but that's the right answer. No right or wrong answers, but that's the right answer. But anyway, so if I notarize it, it's not good in like 20 states. Bonded and insured notary public, notarizing someone's signature, they will not accept it in Virginia. But if you get, again, those same two knuckleheads that are out in your parking lot cooking meth in a trailer in your parking lot, and you go grab them and bring them in to co-sign someone's signature, totally fine. Totally fine.
That's kind of bizarre, isn't it?
It's idiotic. Anyway, okay, so that's kind of what we were talking about.
Blah, blah, blah. Anyway, I have some answers for that.
Okay.
And you can give me a call.
Okay, I thought she was going to answer it here. Do we want to have her on and ask her questions about stuff? About pharmacy, the practice of pharmacy? It's not exactly a weird medicine question, but it has come up. We could do that.
I mean, we've talked about pharmacies before.
It'd be nice to have a pharmacist on.
Yeah.
Okay, so we'll do that. Maybe I'll record her off, the show, and we'll just edit it in, or we could just do it. No, what the hell? We'll do it live one day.
We'll do it live.
Yeah,
we'll do it live.
Fuck
we'll
it.
do it live. Fucking thing sucks. not you, lady pharmacist. So anyway, if you don't know what that is, that's sorry. All right. Okay, here's a good question. So we will do that in the future. I think that's good.
What about Tacie's topic time?
Yeah, that was where I was going next, if that's okay.
Ooh.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
If you send hay, they send hay. But with opening moves on Bumble, you can get to better chats faster. Because if you send most underrated summer activity, they send eating spicy soup in front of the air conditioner on full blast. And that's something you can work with. You're still making the first move, but you can choose a question or write your own to get sent to all your matches. So you can relax and see what they come back with. Download Bumble and try it for yourself.
Pasajeros a bordo, bienvenidos al Friskies Express. Por favor, mantengan sus patitas y colitas dentro del tren. A su derecha verán Crunch Canyon. A la izquierda, Filet Falls. Ahora pasamos al Pico Party Mix. Hoy el tour delicioso está por terminar, pero no hay problema, porque con Friskies siempre hay algo más para explorar. Ve a friskies.com para explorar más.
This episode is brought to you by CarMax. Searching for your next car? Don't settle. Thrive. At CarMax, it's easy to shop online or in person. With upfront pricing and tools designed to help, finding a car you love has never been easier. Plus, you can sell or trade in your current vehicle with an online offer in minutes. No strings attached. Start shopping now to find a car you'll love at CarMax.com. CarMax, the way it should be.
Cool.
Just wondering.
It's Tacie's time of topics. A time for Tacie to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacie.
Hello.
Hello.
So I have...
So nice to see you.
Oh, yes. Lovely to see you. I have 5 very quick topics today.
Excellent.
Cool.
Just very short, brief little
This is where you start
stories.
generating bells, I'll tell you that.
Damn it.
Well, if you did some homework.
Well, no, that's true.
So in 2012 in Indonesia, a person had a tumor weighing 72.5 kilograms removed from his leg. Surgery lasted
72.5 kilograms.
kilograms, yes.
Okay,
Like
so it's 2.2
50 pounds or something?
Echo, how many pounds is 72.5 kilograms?
72.5 kilograms is about 160 pounds.
God, that's close.
Dang.
Removed from his leg. Surgery lasted more than 10 hours, and a crane was needed to lift the tumor away.
Crane?
Yes.
Yeah, I don't think it was a construction crane. I think it was a surgical crane. Probably like a Hoyer lift or something like that, don't you think?
That's a story from the New York
Maybe an engine,
New York
like
Times.
an engine lift.
Yeah. Wow.
So
And
that
where
is the
was
first
the tumor?
one. On his leg.
Oh, goodness
How are you
gracious.
carrying 100? How do you carry that around on your leg? I mean, we've had that person. Did we have them on the show, or did we just talk about the person that had the, 100 and something pound scrotum?
Well, we talked about we didn't have him on the show.
We didn't have him on the show.
No, we did talk about
We
it.
had Horse on the show.
Yeah.
Horse was the guy that that made a living with people kicking him in the nuts and doing and him jumping off of things onto sawhorses onto his nuts.
That's
my
right.
God, can you imagine? Anyway, okay, well, that was a good one. I don't know how the hell he carried it around. Probably didn't.
Probably did.
I wonder if he had a superpower afterward because he had to adjust to that over time. You know, they always talk about, if you take a calf and you lift it every day, could you, as they grew, eventually be able to lift a cow? Because, you're lifting it every day. You get a little bit stronger. It gets a little bit heavier. I wonder if he got to where he could walk normally with that thing, and now he could just run like a mile and it's stupid. Anyway, it sounded, as soon as it started coming out of my mouth, it was like, no, that's stupid, dude. So,
Okay.
You see, your stupid minds.
okay, go.
So number 2.
Yes.
In 2011, a woman in the U.S. had a 4-pound hairball removed from her stomach.
Oh, my goodness.
It grew for 20
I need
years.
stingers for this.
And it caused a lot of weight loss.
You think?
New York Daily News.
I had a friend that was hoping that she would have a 40-pound baby.
I was hoping for that, but it turns out it didn't work out.
No, it doesn't work that way.
No.
All right. That was a good one.
That was a very good one.
Okay. Topic number
Hairball.
3.
Wait a minute. Wait, this is a human being. She had a hairball removed?
4
I
pounds.
was just thinking, how
Okay,
in the
well, she
world
had
did that happen?
trichotillomania.
Oh,
she was eating her own hair.
hair.
Yeah, there is a syndrome
Pulling it out of her head.
called
or arms.
trichotillomania, and those people will pull their own hair out and they will eat it, and they get hairballs because hair is undigestible, and if it can't migrate out of the stomach, if you get enough in there, now it just starts to collect more hairballs.
It's a beaver dam of hair.
Yes, right. Okay, I don't want to give you a bell for that, but that's very good.
Dang it, that was a...
Give thyself a bell.
Yes, dude, just it, baby.
Scott is not getting it for medical knowledge. He's just getting it for good analogies.
Yes, exactly.
All right.
In 2011, a 54-year-old man in the UIK in the
what?
Just make it up.
Okay.
Southern part of France.
In the blank.
Southern part of France.
had an infection caused from a worm living in his eye. The worm had been living in his eye for 2 years. That's from BBC, so it must be from the UK.
Oh, a worm living in someone's ears.
Eye.
I mean, sorry. I
Thanks for paying
I was looking at the picture of the ear that I brought up earlier, and my brain just went into neutral. So worm in eye.
Worm in
okay,
eye.
we got to see what the hell
Okay,
this
you really
is.
don't want that.
Eye worms, a result of an infestation with a parasitic worm, where the larva or adult worm itself moves to the eye. Oh, it's Loa Loa is a filarial nematode that causes Loa Loa filariasis. Loa Loa actually means worm, but is commonly known as the eye worm, as it localizes to the conjunctiva of the eye. Okay, so this lives on the outside of the eye. Was this found on the inside of his eye?
It does not say.
Wow.
Who cares? The worm in your eyes. Regardless, it's terrible.
It says living in for 2 years. So.
Goodness gracious. It almost has to be inside.
People can get loiasis if they're bitten by deer flies, also called mango or mangrove flies that carry the parasite. Another disgusting fly that can kiss my ass is the bot fly. And it can cause larvae that grow under your skin.
Really?
And I remember reading a story when I was a kid about this guy that he had this girlfriend and he was in some tropical country and he thought that she was trying to put a curse on him and she gave him a shirt and told him to iron it before he put it on, and he didn't. And then he got all these weird skin manifestations. He thought that she had cursed him, and what it really was it had botfly larvae on it. I don't even know if this is possible, but he wore the shirt, and then the larvae, wound their way into his skin and then started to grow under the skin. And if you want to see something gross, Google image botfly skin larvae and watch them popping these things out of people.
Ooh.
They're basically maggot-like things that are growing under their skin. And it looks like zits or something, or like a abscess, and you pop it open and there's a living thing in there.
Ooh, that's disgusting.
Yeah, botflies can kiss my ass.
Okay, topic number 4.
Okay.
In 2013, a U.S. man had a 25-pound tumor removed from his face. CBS News.
Really?
Mm-hmm.
So what was the tumor? There's not a lot of detail with these.
Nope.
So say it again.
In 2013,
just because we got to kill time, I figure if you say it twice.
A U.S. man had a 25-pound tumor removed from his face. CBS News. From
face. Wow. Okay. Okay. I've got a different one. 12-pound tumor swallows a man's face. I don't like that headline. 12-pound tumor, explosive growth of blood vessels that blinded him in one eye and invaded his mouth, making it difficult to breathe and nearly impossible to eat. Do this, y'all. When something like that starts up, go see somebody sooner rather than later.
Mm-hmm.
Don't wait until it gets so big that you can't breathe and you can't eat and you can't see.
25-pound tumor.
I have
on
seen
your
people
face.
that have ignored little squamous cell cancers on the skin, which those things will continue to grow, and but they start off tiny, and you can just cut them off and you're done. And I've seen people just leave and go, "Nah, I'm not messing with it. I'm not messing with it." And then all of a sudden, it's eating into a blood vessel in their neck or something, and now it becomes critical. And they have to do something or they're going to die. So just if you see something like that, get it looked at. And if they recommend removing it, just fucking do it.
Well, I would hope that they would recommend removing
No,
it.
I'm just saying when you go, well, okay, some people will go and they've got a mole or something, but it's okay. They don't have to remove that. But if you go and they say this needs to be removed, then please have it removed.
Yeah. Do what your doctor says. Pay attention.
Not always, but yeah, sometimes it's smart to listen to what they say. Yeah. All right, what else you
Topic
got?
number 5.
Ooh, this is the big one.
That's a good one here.
No, this is not. It's not.
Well, is this not the one that you told Scott not to do?
No.
Oh,
when are you going to do that one?
Next week.
Oh, next week.
Oh, okay.
Oh, okay.
In 2013, a woman in India had her ovary removed after it turned into a stone that was over 4.25 inches in size. Largest ovarian stone ever removed.
Wow.
Medical news today.
How big was it?
4.25 inches in size.
I'm looking at one here. 42-year-old woman presented with severe abdominal pain. Now, this is from the Journal of Reproductive Medicine. Plain abdominal radiography, so just an X-ray, showed well-defined calcified mass 4 by 5 centimeters located in the pelvis. Physical examination showed a right adnexal mass. So the way you do that is you get the woman in, what we call dorsal lithotomy position, in other words, pap smear position. And you put your feet in the stirrups. You put 2 fingers in the vagina, and then your other hand, the non-dominant hand on the outside, and you push up on either side, hoping that you can feel ovaries and fallopian tubes. And well, you hope you don't want to be able to feel fallopian tubes, but ovaries and stuff like that. And so when they did that, there was on the right side. So that would be this side. I'm doing it in my head. There was a mass accompanied by severe pain and tenderness when you lifted it. So when they took the fingers that are in the vagina and pointed them upward and then compressed it between the two hands, one outside, one inside, there was pain and they could feel this. So they did a CT scan and they saw 4.5 centimeters, so 5 centimeters, 2 inches. So, it's just under 2 inch by 2 inch mass with an extensively calcified shell. They did surgery, and they found an enlarged ovoid pale brown ovary, which looked exactly like an ovary made out of stone.
Ew.
Interesting, which it kind of was. Pathologic findings were compatible with benign chocolate cyst. That sounds
chocolate.
That sounds tasty. With an extensive calcification and ossification. In other words, it was calcified and turned into bone, basically. Pelvic pain resolved completely after the surgery. Well, I'd say not exactly completely. She probably had pain from the surgery, but that particular pain resolved. How about that?
That's pretty cool.
That's a good one. Well, I'll give you a medium. This counts for 2 bells.
Hearken to thine inner voice and give thyself a bell.
There you go. Good job, Tace.
Good job, Tace.
So that concludes our topic. Yeah. Time of topics.
All right, very good.
Cool, man.
I don't have an outro for that. All right, here's one. Tacie, I'm going to need you to answer this, and I thought I would return the favor and send this one to Mom Swipes Left as well. We'll see. Okay. I just looked at the text of this. I did not listen to the question, but I said this one is one for the women in our room here.
Hi, Dr. Steve. It's Grant, living in Seattle, Washington.
Hey, Grant.
And got a question. Wondering, I was looking for an answer.
Okay.
So, you know how some ladies, I don't know. But so anyway, one time I heard this this woman talking. And
what is Grant listening to in the background? What the hell is that?
Sounds like some Pointer Sisters.
I thought it was like a Chinese opera or something. Let's see.
This woman talking, and the lady said that she had to go to the bathroom, and the man said, "Well, just pinch it." And
pinch
so
what?
I was wondering.
Wait, pinch what?
I was curious. Can
women don't exactly have anything to pinch exactly.
No.
I mean, down there in them nether regions is what I mean. There's plenty to pinch, but
a woman actually literally pinch the vagina to stop from peeing, to stop from needing their...
Okay, so that's an interesting question. But he's only halfway through. I'm curious. Where is this going after this? Because that's kind of the question.
Urge to go stop from needing to go to stop from urinating. Can the muscles in it?
Okay. So he's just expanding on his question. So now there is an incontinence clamp that for men that is basically a clothespin. And the urologist will use it for men that are just constantly, pissing in their pants. Rather than giving them a catheter, you can put this clothespin-like device. It's a urologic incontinence device. And it's soft. Obviously, it's not just made out of wood and, a spring.
It doesn't look like a clamp.
No, but it looks like a clamp.
A wooden clamp.
Right. No, it's soft and it's got Velcro. And you can put more and more tension on it until you stop pissing yourself. But I don't see how Tacie, you take it. I'm as bumfuzzled as Grant was asking this question.
I'm just going to say, let's just say that women the younger you are, the more you can hold it. I don't
Yes.
think you pinch it, but you can hold it. Now,
Could you put a finger on the outside and one on the inside, kind of like a C clamp?
I mean, I've
and then
never tried that.
pinch the urethra. There is urethra there.
It'd be hard to do that and still walk.
Okay.
She probably
Give
could.
thyself a bell.
She probably could, but
Yeah, you'd get a couple of looks. But
That's hilarious.
the older you get,
I guess if
no, I can't hold it at all anymore. If I think of a toilet, and here we go, then I'm going to have to go to the bathroom.
Yeah. Oh, so now you got to go? Do you need to go now because we mentioned it?
No, but I mean,
good hand, try the C
it depends
clamp.
on how long, much longer we
pinch.
have in the show.
The Dr. Steve C clamp.
Yes,
pinch.
yeah, try it. Try it.
No, I'm not
Don't
going
worry,
to do that.
We'll turn our heads and turn the camera off.
Can you imagine? My God.
No, I can't.
So, stop it. Stop it.
No, that's for the next thing.
No, it's not. You're being an asshole.
Oh gosh.
That was for the next thing.
I
I have bronchitis. You remember that from the first Jackass?
I'm not so sure.
Every time the guy had hit the golf ball, they would hit the air horn, and then they'd come after him and go, "What the fuck are you doing?" And he says, "I have bronchitis." It's the most non sequitur thing I've ever heard.
Good movies.
Okay, so pinching your vag, probably not. Well, maybe we
I
get
mean,
somebody.
come on.
If somebody's ever done this, call. But I think it's got to be somebody that wears a skirt and they don't wear underwear, and then they could walk around and
No.
Pinch.
No.
Well, I guess if you had like a food clamp, I guess.
Well,
and what would you
like
clamp?
A potato,
Yeah, I mean,
that was his
Scott
question.
doesn't know
It's
the
not my.
anatomy
It's
either.
not my question.
No, I know. That was your answer.
you ever seen one,
I'm
Scott?
pretty sure that
Dr. Scott's
clamping the
answer
outside
was a food clamp.
That's right. Is not going to pinch the inside.
Oh,
I'm still trying to get over the one that you're talking about for us, a clamp for the penis.
Okay, so just imagine.
That just sounds awful.
Okay, so you have a
Painful in the back.
a plastic sort of tray that is roughly phallic shaped, right? It's scooped out a little bit, and it's got a soft, spongy thing in there, and you put that on the underside of the penis.
Gotcha.
Okay, and then it has a Velcro strap that comes all the way across across the shaft, not long ways, but you know, and then you would just sort of cinch it down to apply pressure. It'd be just like the same thing if you put your hand in your pants and just squeezed and mechanically squeezed, made there enough resistance to flow that you could not flow. That's how that clamp works. And the urologists will use it because, nobody. If all your problem is that you've got sort of an incontinent sphincter coming from your bladder to the penis, then why do a catheter for that? The catheter is just going to increase the amount of infections that you have. And then the external catheter kind of sucks because you're walking around with a bag full of urine on your leg. This thing, you just clamp it off, and then when you need to piss, you just unclamp it, piss, and then clamp it back on, go on your way.
Amazing.
Now, if you, now, if you're getting ready to have intercourse with somebody you don't know them real well, probably go into the bathroom and get rid of that thing
Take it off
before they
first.
see it. So anyway, all right. So here's this next thing that we're going to do.
Oh my God.
Oh, it's part of the next. Okay, all right. Here you go.
Hey, Dr. Steve. This is John from Washington, D.C. How are you?
Good. How are you, man?
This is where I'm supposed to say, I'm supposed to pretend we're having a conversation and say, good, thank you.
Oh, good.
I had a couple questions, actually, about weed. I just turned 40 and trying to give my liver a break and also slim down a little bit, so I have kind of cut out alcohol altogether. Didn't have a problem with it per se, but, would have at least one drink every night, and I still want my treat at the end of the day, and I just don't like being alone with my own thoughts.
Yeah,
so
I get that.
I recently, at 40, decided to start getting more and more into marijuana. And couple of questions for you about that. First of all, I'm scared of edibles and their unpredictability, so I've been vaping for the most part. I assume there's no free lunch when it comes to any sort of substances. So while I might be giving my liver a break, is there a real risk associated with frequent vaping with weed or anything like that? And also, I've noticed, shockingly, that when I get high, I get very hungry, the munchies, all that. Sometimes I end up drinking anyway because it lowers my inhibitions.
Oh.
So I'm just kind of curious, what causes the munchies to begin with? And is there a way to still enjoy weed without getting them? I know some people who do smoke say that they never get the munchies, even if we do both smoke the same strain. So thanks for your help. Have a good one.
Yeah, excellent questions all. And pot is probably the one where if it doesn't, if it doesn't act as a gateway drug for you and you're able to just do it, every once in a while like that, there really is kind of a free lunch with that one because there's not really a known thing like a pot hangover.
No.
Some people, I guess, have it. Everybody's different, but for the most part, the alcohol hangover is kind of universal. Everybody knows what that is.
Right.
But when it comes to the pot hangover, that's not really a thing. But obviously, using street drugs is an issue that we've talked about just because right now a lot of the street pot is being adulterated in some areas of the country because they're trying to compete with dispensaries and all their different kinds of marijuana varieties that they have and stuff like that. So if you want one that jazzes you up, put a little meth in it.
Oh, shit.
And so we're seeing people that are only smoking pot that are getting methamphetamine in their urine drug screens. And same thing if you want something that's going to make you a little sleepier, instead of actually having indica, you just put fentanyl in whatever you got. So that we're having people having that issue as well. So I'm very cautious to say, well, yeah, just street.
Well, what about the vaping though?
So we're just cutting that out. And so let's say this person is in a place where they're buying it and it's legal
from a dispensary.
Mm-hmm. Vaping, for the most part, if they are not using things like vitamin E or weird delivery systems
or weird liquids to
weird
give
liquids,
flavors and stuff. Yeah.
Right. Then you probably are. It's generally considered mostly safe because the byproducts of the properly done vape pen are water vapor and whatever else they're using, polyethylene or ethylene glycol or whatever, that are pretty easily cleared from the system. So check with the place, see what they're using, and then look up the ingredients. And if you want to send them to me, we'll look them up and we'll tell you what the risk of whatever is in your vape pen is. Gummies, yeah, I understand that. It's hard to control, but most people that I know that have done gummies for a long time have figured it out. Yeah. You take it to, Scott's raising his hand. I'm not sure why, but
I'll be able to help you with that.
Okay, well, okay.
When you're ready.
No, it's fine. What I meant was we're in a state where it's not exactly kosher, so I'm sure that you're just speaking hypothetically.
And I've traveled to states where it is kosher.
There you go. Okay.
And buying from a legal place.
But you just figured out, how ahead of time to take it.
Yeah, and like in Colorado, for instance, the edibles are 10 milligrams a piece.
Right. You cut them into fourths.
Well, that's considered a normal adult dosage.
Right.
And the thing is, the big difference between edibles and the vaping or smoking is that the edibles have a longer onset, so it takes you longer to feel it.
Right.
And that's where people tend to screw up. They'll eat one 30
minutes later, they don't feel anything.
They'll be like, I don't feel anything. So
I'll have 5 more.
2 or 3 more. And it's like, oh, God.
Yeah.
Now, all that's out the window if your buddy brings over a plate of brownies.
Right.
And he just made his own. You don't know what the hell's in there.
Right, that's right.
Or how strong they're going to be. Then
vaping, you get that immediate effect. Here's the problem I have with cannabis compared to alcohol. If you're just going to have your treat at night, you drink one bourbon at night or whatever, and it's in and out, and in 20, 30 minutes, within an hour, you're legal to drive, all that stuff. Cannabis just hangs around for way longer than that.
And can I speak to that too?
Yes, of course.
Because you're right. Because let's speak in terms of insomnia. Specifically insomnia. You're right.
Okay, now insomnia, then it's beneficial.
Right,
go ahead.
Because that's what I was going to say. Because if you drink, a couple drinks a night to go to sleep, which a lot of people do, your liver metabolizes that liquor in the middle of the night.
Then you wake up,
and then you
ruins your sleep cycle anyway.
And the thing about the edibles, because they do take longer to kick in, then they last a little bit longer. Typically at nighttime, it doesn't have to be just THC, Dr. T. It can be, a lot of the hemp, the
could be CBD and a nasal spray. I wonder where someone would get something like that.
Someone would get such
well,
a
that's
great.
because you're an idiot.
But the CBD,
simplyherbals.net,
yes,
everybody.
Yes, thank you. The CBD, I've had some really good success too. With that is legal in the state of Tennessee.
Well, it's basically mostly legal everywhere, depending on how it's made. But I have found a little CBD at bedtime really does help me sleep better.
Me too.
I can tell the difference. So, and there doesn't seem to be much of a downside for that. Matter of fact, CBD is indicated for certain maladies, including refractory seizures in children. So it seems to be pretty safe as far as what we know right now. Now, continuing, one thing we didn't do is answer his question on the munchies. So there is some science behind this. Tetrahydrocannabinol, which is THC, binds the cannabinoid receptor type 1, so CB1, we'll call it that from now on. And this can promote overeating and weight gain. And it is detrimental to some people, but it's beneficial under certain conditions. As a matter of fact, we use it in a medication called, the brand name's Marinol. The chemical name is dronabinol, but it's just because they don't want to call it tetrahydrocannabinol. And we use that for people who have chemotherapy-induced nausea and vomiting. Wasting diseases like HIV and stuff like that. It works very well.
Works exceptionally well, yep.
So, the cannabis binds to these receptors. They're in our brains. It's because we make cannabinoids. So all of these things that stimulate receptors in our brains, like opium or morphine, stimulate the mu opioid receptor. That's because we make what we call endogenous molecules. In other words, they're made inside our body that stimulate those receptors. And so all we're doing with these plants is just hyper-stimulating those receptors above where we would physiologically, right?
Okay, gotcha.
So CB1, the receptor is found in a bunch of different places in the brain. One is a place called the basal ganglia. That's where it enhances eating pleasure.
Okay.
It's also in the limbic forebrain. There's not going to be an exam, so don't worry, but these are different parts of the brain where
the pleasure center
enhances the taste of food. Okay, because there is a place in your brain where taste can be dialed up or dialed back down. Because we eat for pleasure, but we also eat to live, and then it's also CB1 is found in the stomach and the small intestine. And Tacie, you'll know this one because you dealt with this in your job. They regulate ghrelin. You remember what ghrelin is?
Nope.
You don't remember it? Okay. It's an appetite-stimulating hormone that speeds digestion. And so it's a target for some of these weight loss drugs, but also for diabetes, some of the diabetes drugs, future target for that. And then it also, I remember seeing it in some of your materials when you were training, but that's okay. She said F that.
Nope.
And then also in a part of the brain called the hypothalamus. And the hypothalamus helps to regulate food intake. So how interesting is that? Now, when you activate CB1, there are known mechanisms by which appetite is increased. It increases your levels of a thing called peptide tyrosine, so PYY, that increases your levels of ghrelin, and that increases your appetite. What about that?
That's cool. That's good
That's
stuff.
pretty cool.
It's science.
There's more to it than that, but those are the big ones. The ghrelin one is the one I think is the most important. So that's how it causes the munchies, and not sure exactly what you can do about that. I think I know that if I ate a relatively low carb, high protein meal, and then if I happened to, if someone, I don't know, put a gummy in my food and I took it by accident, then I didn't ever actually get the munchies if I got it. You know what I'm saying? Because I would never, of course, take that stuff intentionally. But I found that the times when someone whose name rhymes with Flanda might have slipped something into my food, that if I had a high protein meal before that, I didn't get the munchies, but if I didn't, I did. So you could try that.
Hey, Amanda was just saying on here that in Colorado,
and it wasn't Amanda.
No.
That also rhymes with Flanda.
It does, yes. She was saying that, but to your question, because you made one statement, they I guess some of the dispensaries do claim that some of their strains do not cause as much of the munchies as other strains.
That would be a fun.
Which makes sense.
Okay, they can make any effing claims they want to, and we need
Prove
data.
it. Prove it.
Data, and that would be an absolutely fun clinical
Little
trial
experiment,
to carry out. We'd only need like an N of 20.
Yeah, or 3
and some and some free
At
stuff.
least 3 of us,
yeah.
some free
So if any of you dispensaries want to make claims like that and you want to actually set up clinical trials, I'd be happy to help you do that. I think that'd be fun.
I've got a contact in Colorado, this cannabis company, and we can. They want to come on the show. We can talk to them.
Okay, and the thing, I would love to do that.
Yeah, because they do this. They actually have biochemists that they employ to do all the testing.
Well, biochemists can't do clinical trials.
No,
but
we can.
But we can.
Yeah.
And the thing is that they can participate in them, but they can't run them.
Right.
Now, if
yes, we have a plan.
If I'm just getting a bunch of different ideas, but
focus, Dr. Steve. Focus.
Yeah, and if it turns out that it doesn't do what they say, you just bury the study. That's what everybody else does.
Eat more
or they
Doritos.
Lay off all your employees.
Yeah, or they lay off all their employees because their drug didn't meet FDA muster. Certainly just speaking about something that hypothetical that didn't actually happen to Tacie.
No.
All right. But yeah, I would love to do that.
Cool.
Okay, so you had a question.
Yeah, we've got a question from Evan.
From the waiting room.
From the Fluid family.
If you want to join the Fluid family in the waiting room, just watch go to our YouTube channel and click, a notification, subscribe and notification. And then when we go live, it'll let you know. Go ahead.
Yeah, so I am a binge drinker in my early 30s. I've developed a facial twitch. It's on the right side of my face and cheekbone. It's annoying enough to keep me awake sometimes. What causes this? Question mark, exclamation point.
Okay. So it's just one side of the
Just
face?
one side. He said he does get it during the day and at night sometimes. And he said occasionally, here's a little bit disconcerting, he does get a little numbness too.
Okay. You guys want to take a crack at it? I think I know what it is.
I do not know.
Well, I was going to say I can think of a number of things, but I mean,
there's a name for it. It's called hemifacial spasm. Now that is not it's not a diagnosis in the sense of
it's just
it's just a descriptor.
Yep.
But hemifacial spasm is where the muscles on just one side of your face will spasm involuntarily. It's usually caused by a blood vessel that's touching the facial nerve.
Right.
Okay? Yeah. And so the facial nerve is the one that controls, facial muscles. Mm-hmm. And if you have a blood vessel that's up against it and it's pulsating, every once in a while it will trigger that damn nerve to and the whole face will twitch.
Yep.
But it'll only be on half of the face.
Yep.
So that's probably what it is. It can be caused by facial nerve injury, and sometimes there's just no known cause.
Yeah. Sometimes stress, sometimes pressure.
Yep. Who would you see for that? Maybe a neurologist to start with, and if it happens often enough where you can show them, hey, it just happened, that would be great. If not, if it's happening, take a video. Take a video of yourself and then take that with you, or go to your primary care. But a neurologist to be the one that would deal with this.
I was just wondering too, possibly because I was thinking facial nerve stuff too, but possibly maybe since he is a binge drinker, maybe because he's already said he's going to stop drinking. Yeah. Possibly a mineral deficiency, calcium deficiency, potassium. Possibly, I don't know.
It could be magnesium.
Magnesium, possibly, yeah.
Maybe.
But I would
take a multivitamin, but I wouldn't take a multivitamin and go, I can keep drinking.
No. No, he clearly said he was going to stop. But I think that having someone look at it just in case to rule out anything kind of goofy would be a really good idea. I think so.
Yeah.
Start with your primary care doc. Let them.
1 in 6 adults binge drink, so you're not alone.
No.
25% of those do it at least weekly. And it's just one pattern of excessive drinking, but it accounts for nearly all excessive drinking. So, because people on the weekend, and then they just start, knocking them back,
Yep.
More common between adults aged 18 to 34, more common amongst men than women. And it's more common among adults who have higher household income. That kind of makes sense. If you got a job and you're holding down a job and then you get off and it's like high pressure and you start slamming from Friday to Monday afternoon. And so there are some risks. And I'm just going to throw this out here just to help him. Unintended pregnancy is one. And I know we're laughing because he's a dude, but, it's still unintended pregnancy and poor pregnancy outcomes. Now, sudden infant death syndrome, why? I don't know why. I'm assuming that's due to parental neglect. I don't know. I'm getting off the CDC, so chronic disease, but the big ones, chronic diseases such as high blood pressure, stroke, heart attack, heart disease, and liver disease, and certain cancers are associated with binge drinking, and memory and learning problems. So, let's if you're binge drinking, let's get off that. If you need help, seek help.
Yep.
We can help a little bit, but we can point you in the right direction. Go to a meeting.
Yeah.
I'll tell you what, I haven't had a drop in. I just quit drinking for the hell of it. And because one day I just woke up, I said, this shit didn't help doing it. It's not doing anything for me.
Right.
So I've been drinking kombucha instead. And that, for me, it turned out I just needed something at night that I could drink that I enjoyed. And I just kind of like the taste of it. So now we're going on vacation. I might drink, I might not. I'm starting to think I might not.
Well,
it's totally up to you. That'd be okay.
I know. Yeah, that's the thing. It's I'm not sober because I was never not sober, but I'm not drinking right now. I went through a period of 2 or 3 years in my past where I just didn't drink.
Then you met me.
No, I met Tacie. That's what did it.
Good, thank you. I was thinking that was my fault too.
No. I was totally. It wasn't Tacie's fault.
No,
it was just. Well, I mean. It was,
but
but I'm just
saying. We would never say that to her.
It was my choice, but I didn't drink for 2 or 3 years before she and I met, and then I wanted to be cool because she was younger than me, and that's one way to be cool is to drink. Man, I was so stupid. So, but anyway, yeah, and then so I'm just in that phase again. I can come and go. Anyway,
cool,
all right,
man.
anything?
All right.
All right, good luck with that. Who was that?
That was Evan.
Evan. Okay, Evan. If you need if we can help you with that part of it, absolutely email us, and you can just go to drsteve.com and click contact, or go to a meeting if it's something that you're having difficulty doing on your own, and you can do it. The thing is it really, if you're binge drinking on the weekend, just don't binge. You're not drinking during the week. It's just habit at this point. I mean, I make it sound easier than it is, but we would be happy to help point you in the right direction. All right. Well, listen, thanks to everyone who's made this show happen over the years, and listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. And go to our website at drsteve.com for schedules, podcasts, and other crap. And Holly will be seeing you in 1 week. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks.
Goodbye, everyone.
See you guys.